Hello there, my name is Juan Retamero. I'm an anatomical pathologist and I am the medical director for Paige. I would like to introduce to you today a poster entitled Pathologist-led Definition of Generalisability and Performance Metrics for Clinical AI Ensure Patient Relevance, Performance and Clinical Usability. As we all know, artificial intelligence is being increasingly applied to pathology with the promise of increasing pathologist performance, but also to help them be more accurate in their diagnosis and more efficient. The aim of our poster today is to test how an algorithm performs on a very different data set to in which it was trained. So the algorithm was initially developed using multiple instances learning, which essentially is a way to train algorithms that requires large amount of data. That is the downside. The upside of multiple instances learning is that in theory, it does provide an algorithm with more robust outputs. And that is what we wanted to test today. So the algorithm was initially trained using approximately 33,000 slides originating from almost 7,000 patients. All of this data set actually came from about 800 labs from around the world. And that is how we trained the algorithm. The next step was to train how applicable are the outputs of this algorithm into a population that would be very different to this training set. And to try that, essentially, we went through a data set that was completely unrelated to the training data set, coming from a different institution. And that testing data set comprised almost 2,000 previously diagnosed prostatic corneal biopsy. What we did see in the results is that without any further calibration, without any further training, the algorithm was capable of performing with near perfect sensitivity. But what is even more important is that when pathologists were aided by the algorithm, they increased the sensitivity quite significantly, as you can see in the graphs in the poster. Not only that, the average time for a pathologist to classify a slide and decide whether it was malignant or benign was significantly shorter when artificial intelligence aided the pathologist in their assessment. So the conclusions that we can reach is that the in silico validation measures do not necessarily correlate with the clinical performance. And at the end of the day, what matters is that pathologists get tested with the assistance of the algorithm and compare their performance without the assistance of an algorithm. The second conclusion is that although multiple instances learning could be very data intensive, it is probably worth it because at the end of the day, the results are more robust and can be extrapolated to different populations than with other training methods. I hope you enjoyed our poster today and looking forward to seeing you